Hi. So this is like the fourth take of this that I've tried, and I'm experimenting to try to find the best approach of how to go about telling my story. So first of all, the reason why you're here is because you're looking to follow my experience through spinal surgery, specifically the DLIF or XLIF, which stands for Direct Lateral Interbody Fusion. I am undergoing this surgery at the L4, L5 region of my lumbar spine, and that is following a 3-year-old disc herniation. So to tell you a little bit about myself, I'm Erin. I'm 24 years old. Today is June 29th. I am having my surgery on July 9th, so it's 10 days away. About my back, I have had a bad back since middle school. In middle school, I received a diagnosis of lumbar facet syndrome, and I used to not be able to get up from the floor if I laid down straight, that I just kind of get locked in place. Would have good and bad days, good and bad weeks, good and bad months. And then while I was in college, I woke up one morning in August 2009 and I couldn't get out of bed. When I finally made it to the emergency room, they gave me an MRI and determined that I had herniated my L4, L5 disc, and it's kind of been an extensive journey from there. I was prescribed by my first neurosurgeon very mild and conservative treatments. I went through about 4 months of physical therapy 3 times a week, and I made, significant gains in that I'm able to put my clothes on by myself and walk around, whereas the first week of my injury I was pretty much bedridden and in excruciating pain. I also went through 4 epidural lumbar cortisone injections, and those injections were interlaminar, not transforaminal. I've had 3 years now where I have had some improvement, but mild improvement. It's still impacting my day-to-day life. I can't sit or stand or walk for any extended period of time, and by extended I mean like 40-45 minutes. So I can't go to a museum and see an entire exhibition. I can't go for a hike. I can't exercise. Any of those things leaves me in pretty debilitating pain for about 3 days following. So it means that if I engage in any of those activities, then I can't go to work the next morning. It has also affected my major academic path. I've had to reassess what I'm able to do because of my limitations. It's also hindered my job prospects because while I was in school and now in my intermediary period before I figure out grad school, I can't just go and get a retail job or get a waitressing job because I can't stand for extended periods of time. I can't walk for extended periods of time. So it has really impacted my life, and at 24 years old, I'm at a place where I really need to be making decisions about what direction I'm going in, and I'd like that not to be limited by my spine. So I pursued surgery about 2 years ago and found a surgeon that said I would be a candidate for a microdiscectomy. And we were about to explore that after I tried some transforaminal epidural injections, but right at that point I lost medical insurance. So that brings me to now, when I finally have medical insurance again, thanks to Obamacare and being covered under my father's plan until age 26, that I was able to find a new neurosurgeon, and it was probably the happiest day of the past 3 years when he told me that he thought I would be a great candidate for lumbar spinal fusion surgery. I have, of course, spent the last 3 years obsessing and researching and trying to figure out the best option. And though it's kind of extreme, well, it is extreme for a 24-year-old, it's my best bet of having normalcy back in my life. I also, in addition to the chronic lower back pain, I have left leg radiculopathy, so I get numbness, tingling, weakness in my left leg, going from my back through my butt to my thighs, through my knee, down my leg, into my toes. So it really affects the whole thing. I have had prescription painkillers for the past 3 years that they don't even touch the pain, so I hardly use them. But it's been a long road. I've had 4 MRIs. I've had 3 sets of x-rays. I've done the whole gamut, and I'm just ready for this to be something that's in my past. So right now, I'm 10 days before surgery. On Monday, I go into the hospital for my pre-admission testing, and they're going to do blood work, a chest x-ray, and an EKG. And that's just to make sure that everything's in tip-top shape, and I am ready to go under the knife. So for those of you who don't know, well, I'm sure if you're watching this you do have an idea, a DLIF is the minimally invasive route. Instead of going in through your abdominal cavity or opening up your back, the surgeon makes an incision in your side, in this case my left side, and from the left side he will access my spinal column. He'll remove the disc, so a microdiscectomy at the L4, L5 level, and a laminectomy, and he'll insert a PEEK, that's P-E-E-K, a PEEK spacer into the intervertebral space from that side axis as well. And then after that's completed, he'll flip me over onto my stomach and make 6 small incisions in my back, which will allow for the subcutaneous placement of the screws and the rods. So I will be completely fused at that L4, L5 level, and hopefully achieve bone growth and fusion over the course of the next year to 2 years. I am scared, but I'm primarily excited because it's been a long road, and even if it's a year or 2 years recovery, I'm already 3 years in with chronic pain, and it can only go up from here, I think. So I'm going to try to keep this updated and give everyone a good impression of what the process is like. I come from an osteological background of study, so I'm comfortable with the medical terms, so if you're not comfortable with them, you can leave a comment and I'll try to define whatever your question is. I guess that's really it for this first entry. I'll make another entry just to explain what happens with the pre-admission testing on Monday, although I'm going away Monday, so I might not do it on Monday. But yeah, I'm going to keep this updated and make sure that I can provide a resource for people like me who are looking into the surgery and who can't really find anything. So thanks for coming on this journey with me. Bye, YouTube.